Hi, today I would like to talk about stents. Stents are metallic mesh or scaffoldings that are inserted into the coronary arteries after an angioplasty procedure. Why are stents necessary? Early days of angioplasty, what we've learned is that after the ballooning procedure, a third of this vessel will re-narrow again within the next 6 months. The recurrence rate after 6 months would be in the order of about 30 or even 40%. This re-narrowing happens because there is recoil of the tissue and there is inflammation. With the advent of the stent, this metallic tube that is inserted that provides scaffolding, the recurrence rate has been reduced by half to approximately 15 to 20%. To summarize, I would like to say there are 3 types of stents that are used in clinical practice. The first generation was the bare metal stent. That was a stent that was introduced back in the early 90s as a scaffolding to prevent restenosis following an angioplasty procedure. We all know that following an angioplasty procedure, after ballooning of the vessel, there's an inflammation process that happens, and a third of these vessels will recoil and re-narrow again within 6 months. To counter this issue of recurrence, metallic scaffolding or a stent has been invented to provide support and prevent recoil of the vessel. First generation of stents, which is made of pure stainless steel or cobalt chromium, very effective in reducing the recoil and reducing the recurrence rate by half, from 30 to 40% to 15 to 20% recurrence rate. However, 15 to 20% recurrence rate was still regarded as high. That means 1 in 6 patients will still recur with need to proceed with a second angioplasty. Hence, the second generation of drug stents came about, which is the drug-eluting stents, second generation of stents, drug-coated stents. These are now stents which are made of the same platform, which is made of metal, stainless steel, cobalt chromium, but they have drug coating on it. These are anti-inflammatory drugs that are coating the stents, which is eluted from the stent to the tissue around the arteries over the course of a few months. When the stent is implanted, being a foreign object, there is inflammation that occurs. These drugs are anti-inflammation in properties and they prevent the recurrence rate that occurs with the implantation of a foreign object. So it reduces the restenosis rate to less than 5%. So which means that out of 20 patients going ahead with an angioplasty procedure, if a drug-coated stent is implanted, the risk of recurrence or re-narrowing is now less than 5%. 1 in 20 will have a re-narrowing. 19 out of 20 patients will not suffer a re-narrowing if they take good care of their heart and comply with their medications. The third generation of stents is the bioabsorbable or dissolvable stents. This one came about a few years back when there was this idea that we don't need a stent to be in there as a long-term prosthesis. Stainless steel is permanent. Once it's implanted, you cannot remove it, whereas the biodissolvable stent is made of a biosynthetic material which dissolves over a period of 2 to 3 years. The whole idea is that it provides scaffolding and support to the blood vessels during the initial angioplastic procedure, and once the vessel has healed up and there's no need for the scaffold anymore, it will dissolve over the subsequent couple of years. Although in theory it sounds great that you may restore a normal vessel after 2 to 3 years down the road, what we have learned is that as this stent dissolves and breaks down, the matrix breaks down, it loses support, then there's a sudden collapse of the vessel. That has been reported in the literature and has led to even few catastrophic events such as sudden heart attacks. And today, these stents have now been withdrawn. So currently, the best stents that we have, or the gold standard that's available right now, are basically the drug-coated medicated stents. And the current generation of drug-coated medicated stents are now utilizing newer drugs which are more effective and more durable in terms of reducing the restenosis rates, and they are made of a platform which is improved. The metallic platforms using smaller struts, they are more deliverable with a better safety profile. So these are now the latest, or what we call state-of-the-art stents that we have in current practice.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.